Okay, welcome again to the next video in the series. Now we're going to show you an example case of someone with disease. We're looking at a 53-year-old female who's a diabetic and just being evaluated in general. Here's her ECG. It's a normal-ish ECG. It does have a couple of little hints from the conventional ECG. We, for example, see that the P wave in lead V1 looks inverted and maybe a little long. We can see that the P wave duration is 120 milliseconds, which is borderline abnormal. And the other hint of an abnormality I see on the conventional ECG is just a slightly prolonged QT interval duration as corrected at 470. So that's a little abnormal for a female. Let's go in, see what the automated diagnosis is in this case. And yeah, it picks up the possible left atrial enlargement. We'll also go in and take a quick look at lead AVL, just make sure there's not a Q wave there. There isn't, so there's no sign of old MI in this tracing. Now let's go in, we'll start running the recording, and we're about 30 seconds in here now. And let's go to our advanced ECG applications again. We'll start out with the signal average ECG again. We're going to make sure our fiducial points are correct before we make any assumptions about the parameters that we subsequently see, and those look okay in terms of the beginning and end of the P, Q, R, S, and T. Let's go in and take a look at our parameters again. Now here on the 3D ECG for this patient, this diabetic, the loops look okay to me again. I don't see any evidence for old infarction here. You kind of need to refer to an old VCG textbook to understand how to read those, but just like with our healthy subject, those loops look pretty good to me here. So I'm not worried about old infarction, and in fact the QRST angle is normal as well in the 40s. There's one spatial parameter that's a little out of line, but that's not uncommon to see. So this certainly could be from a healthy subject if this 3D ECG was all that I had access to. But let's go take a look at some other parameters. Let's have a look at QTV again. We're in the first eigenvector here, and the first thing you see is the R-to-R interval variability in red is pretty flat compared to the QT variability in purple, which is moving along and doing its own thing. So we have a dissociation between RRV and QTV, which is pretty obvious to the eye. Let's look in lead 2, and we can see it even more obviously there, where we have this dissociation, and we can see the QTVI is abnormal as well down on the bottom. And over here, when we look at the right, we can see that things are more vertically oriented. If you remember before, with the healthy subject, we had a much more diagonal orientation of the QT interval beat to beat versus the R-to-R interval. So the pattern is very different here. We have a dissociation between QTV and RRV. Let's go on and let's look at RRV itself, and we can see again as it continues to run basically a flat line there in the tachygram. Usually a 50-some-year-old female should have a better RRV than that. Look at the histogram, looks kind of more like the Seattle Space Needle than anything else. You remember the healthy subject looked more like sort of a Egyptian step pyramid in that histogram. So we're seeing some abnormalities here. The Poincare plot, or little blob there, is very small compared to the healthy subject we saw earlier, whose blob looked maybe that big, a lot bigger, maybe 2 or 3 times as big. Down here in the power spectrum, we're basically seeing nothing. So very little heart rate variability or RR variability. Switch to the spectrum. Let's take a look at the spectrum in detail, and we're flagging all over because we have such poor heart rate variability by the power spectrum. So we see abnormalities in QT variability and in heart rate variability. Let's go on now to our next parameter, and let's look at T-wave complexity. Look at complexity in general, but T-wave complexity especially, and we can see we're red flagging here in complexity as well. That PCA ratio is well into the 30s, so that's abnormal. And some other parameters, too lengthy to explain, but so we have some other flags in T-wave complexity as well, and different ways that we look at some of the ratios there. So we have abnormal T-wave complexity, and we have abnormal QT variability. Go back, you can see our QTVI, or index, is about minus 0.3, which is abnormal. Abnormal heart rate variability as well. And we'll go and take a look back at 3D ECG. So structurally, the 3D ECG looks okay, normal-ish. So we have a combination of abnormalities that we'll have to let the statistics tell us whether or not there is an overall disease pattern or not. And we'll do that in a later video.